Hello, everyone. Thank you so much for joining us today. We're Roseman University College of Pharmacy, and we're so excited to have all of you that are here in attendance today and those of you that are going to be watching online a little bit later. But today we're here to talk to you about a couple of things. We're going to talk to you about the amazing career, which is the career of pharmacy. I'm going to give you a little insight into what my practice has been. We're also going to talk to you about Roseman University College of Pharmacy, what makes our program unique, and a little bit on the admissions process. Like, how do you get into Roseman University College of Pharmacy? What do I need to do? What am I looking for? So I wanted to take a little bit of time and introduce our team. So I'll start off with myself. My name is Dr. Christensen Grant. I am the Assistant Director of Admissions and Student Affairs, and I'm actually located in Utah, so our South Jordan campus, but I really help facilitate admissions along with our team for both campuses. I'm also a clinical faculty member, and I'm an internal medicine pharmacy specialist. And with that, I'll let Dr. Park, would you like to introduce yourself while you're here? Just a short little intro.
Sure. Hi, everyone. My name is Helen Park. I'm the Assistant Dean for Admissions and Student Affairs for our College of Pharmacy at Roseman University. I've been at Roseman for a little over, I think, 6 years now, and it's actually where I chose to earn my PharmD degree. So I'm very much passionate not just about our profession, but about Roseman as well, and just excited to have you all here today.
Look at that. We have a tried and true alumni with us today as well. So why don't we next talk to Miss Lisa Stone, another member of our admissions team?
Hi everyone, my name is Miss Lisa Stone. I'm the admissions specialist. I'm located here in Nevada. However, I'm the admissions specialist for both campuses, and I am here to help you with your journey through pharmacy school. So if you're interested in joining us at Roseman, I placed my contact information on the screen there. So please feel free to reach out to me as you complete your journey at NSC and come to us at Roseman after.
Thank you so much. So lucky to have you both on the team with me and to have you here today. I'm also excited to see all of you that are here. If you're here and you feel comfortable, feel free to turn on your video. We would love to see you. But if not, we'll answer some questions at the end of the presentation. So I wanted to start off with like, what does a pharmacist do? Like, I think I know what a pharmacist does, and I will plead a little bit of ignorance on my end. When I started pharmacy school, I thought I knew what pharmacists did until I got into pharmacy school, and all of a sudden my eyes opened up. So no matter where you decide to go to pharmacy school, every single pharmacy school in the country, you will be getting a doctor of pharmacy degree. A doctor of pharmacy, you are the expert in the field that you are choosing to go into, which is medication therapy management. So we're up there with MDs, we're up there with PsyDs, doctors of nurse practitioner, doctor of nurse practitioners as well. So all of us are doctors at the end of our degrees, the experts in our field. So whenever it comes to pharmacy, we're medication experts. There's no one that's going to know the medications like you do. I had a patient that came into the emergency department, had a black widow spider bite. And normally with a black widow spider bite, we just allow patients to kind of symptomatically manage, help them with their pain, but there is an antivenom that you can use. This particular patient, they were getting ready to administer the antivenom, and I said, wait a minute, I'm the pharmacist. Let me take a look real quick. I just want to check everything, make sure it's good to go. This is a fairly expensive medicine. I want to make sure we're using it appropriately. And they were like, no, I think we're going to give it. She's really uncomfortable. And I said, okay, let me just take one quick look. Well, it turns out that the patient had an allergy to horse's serum, and the medication itself is actually made in horse's serum. So it could have potentially caused a life threatening reaction in that patient. And it's no fault to my nursing colleagues, my physician colleagues. It was me. I am the pharmacy expert. I am the person on that team that is my job to find that. So that's kind of shows you what a pharmacist does. We are patient advocates out in the community, in hospitals, and clinics. We are there trying to make sure that patients don't pay more money than they need to for medications, that they're using medications that minimize side effects, and that they're using the medications that are giving them the biggest bang for their buck, giving them the biggest benefit to their disease states. We're also increasing increasing in our prescribing rights all across the country, and in both of our states, Nevada and Utah, those rights are expanding, and you're seeing expansion of prescribing rights all over the country. In my particular state here in Utah, we have collaborative practice agreements where working with a physician, they can say pharmacy to manage blah, blah, blah. And at my particular hospital that I worked at, it was like diabetes or anticoagulation. And the pharmacist then would take over, ordering labs, prescribing the medications that needs to be prescribed, following up, counseling the patient on those new changes that we've made. So really cool things in the area of pharmacy. And we are healthcare providers as given by all these stories. And we're also really on the front line of giving immunizations to the entire US population. We're really on the front line. And given our current pandemic, we will be a solution when the COVID-19 vaccine comes as well. So there's lots of different areas of pharmacy. I think a lot of us feel pretty comfortable with certain areas. Like we see our pharmacist that works in the community. That's why we're often called the most accessible healthcare profession, because we see patients that just, you'll be at the grocery store or you'll be at Target and you're like, oh, I have a little scratch in my throat, or oh, my ear's been bothering me, or oh, I need a vitamin and I'm not sure which one to take. Who is the easiest person to just walk up and talk to while you're grabbing your milk or going shopping for something? It's your pharmacist. And so I think so many people are really familiar with their community pharmacist. It is a large portion of our work sector, but the roles of those community pharmacists are expanding as well as they're running their own clinics. They're giving immunizations right there within their pharmacies. But there's also many other types of pharmacists. There's ambulatory care pharmacists that work directly in clinics where patients will have meetings with their pharmacist, 30 minutes, 45 minutes, an hour-long meeting discussing medication therapies, diet changes, lifestyle changes. So those are ambulatory care pharmacists that work in clinics. There's also pharmacists that work in various settings in the hospital. There's critical care pharmacists that work in our ICUs, infectious disease specialists that purely focus on infectious disease. There's pediatric pharmacists, poison center pharmacists, even pharmacists that work in veterinary medicine. And we're going to highlight a couple of those today. So here's a highlight on some of our actual faculty that work with us here at Roseman University College of Pharmacy. Hopefully this first guy looks a little familiar. Hint, it's me. So I'm an internal medicine pharmacy specialist. That means that I take care of patients that are in the hospital, but not sick enough to be in the ICU unit, so not the intensive care unit. And I'm going to give you a little breakdown of what my typical day would look like as an internal medicine specialist working in the hospital. We also have Dr. Gundram, who is an oncology pharmacy practitioner. We have Dr. Viswesh, who is a critical care pharmacy practitioner. And then we have Dr. Madison, who is a public health pharmacy practitioner. So we're going to talk a little bit about how our jobs are ever so slightly different, but I'll do a little bit of a highlighted focus on what I do. So I take care, as I said, those patients in the hospital that aren't in ICU. So I see so many different types of disease states. I'll see septic shock, which that means the patient has such a severe infection that it's affecting their organs like their liver or their kidneys, heart, or brain. So very severe infection. I'll see patients that have things like diabetic ketoacidosis, which is simply put a diabetic emergency, and I'll help manage that. They could have strokes, heart attacks, just a number of things. And the complexity of all of that is part of the reason I really love my job in the acute care setting. I take care of people when they are at their most sick, most complex, and I can provide benefit. I can help to choose therapies that are going to be beneficial. So my team that I normally work with whenever I was working on the unit was I would typically have two pharmacy students from Roseman with me on rotation. I may or may not have a pharmacy resident with me. So that's a pharmacy student that has now graduated. They are a practicing pharmacist, but they're choosing to continue their education postgraduate to get some more advanced training. So they would often be on rotation with me, working underneath me, but slightly They're a pharmacist above the students, so we kind of had this tiered learning model. And then I would work with a nurse coordinator who would help organize all of our patients, make sure we were following up on everything, and then one medical attending, and he may or may not have a resident with he or she. And so that was my typical team, and we would take care of anywhere from 20 to 40 patients in a single day. 40 patients was a lot, but sometimes we would get that way. More commonly, we would typically sit around 20 to 25. So my typical day, so as mentioned earlier, in the state of Utah, we have what we call collaborative practice agreements, where physicians can turn essentially over certain areas of care over to the pharmacist. So at my hospital, we could do diabetes management, anticoagulation management. These are medications that help you from getting blood clots, but if dosed incorrectly, can very quickly cause you to have some severe life-threatening bleeding. And then also we would do what we call vancomycin dosing. Vancomycin is a very powerful antibiotic, but the dosing is very, very customized, meaning that every patient on this call today or person could have a different dose based off their weight, their gender, how well their kidneys are doing. And if you dose it incorrectly, the antibiotic might not work, or it could have some very severe side effects. And so the physicians would often say, let's have pharmacy manage this really complicated medication. And so in the mornings, I would have my students practice on these collaborative practice agreements, come up with their therapeutic plans. What drugs did they want to give the patients? What labs did they want to monitor? And then they would work up their patients that they have for that day. And I would look at all the patients on the team. And then from 8 to 9, we would review all the patients together because I wanted to make sure the students felt comfortable with their plans. They were vetted through me and that they had thought about everything that needed to be thought about, and we would prepare to head out on our rounds. And then from 9 to 12, we would do what we call pharmacy rounds, where we would go bedside to bedside, see every single patient, tell them what has changed in the last 24 hours, tell them what changes we would be making to their medication therapy. And then we would follow up with our medical team, so our nurse and our medical attending, and say, hey, here's the patients we talked to, here's the changes we're going to make. And we would just run everything by with them as well. And then in the afternoon, we would follow up on our patients' changes that we'd made. Sometimes we would go down to the ER and admit with our physician new patients. My students would have presentations that they would be given to the nursing staff about safe medication use, or maybe to the attendings about a new medication that's come out that we want to inform them about. Or we would go to the university where the students would maybe interact with other students on other presentations or things like that. So that was my typical day. And I really, really loved it. Next, we have Dr. Gundrum, who's an oncology pharmacist. So she actually takes care of patients that require chemotherapy for their cancer, but they can actually get it in a clinic setting. So they're well enough that they can come in, see her, receive their chemotherapy, and leave. So she said her typical day consists of working with nurses and providers to make sure safe and effective cancer treatments are given. She reviews labs every single day to make sure that the potentially curing therapy is all set. She'll order preventative medications or supportive medications to make sure we don't have excessive nausea or vomiting, and to prevent life-threatening infections. And then she says another really important part of her job is continuous process improvement. Because these medications are so life-saving and so costly, she makes sure that the process is streamlined to make sure it's effective and eliminates waste. Then we have Dr. Viswesh. So he takes care of those patients in the hospital that are in the ICU. So these are the sickest of the sick. So he'll round with a team of physicians and take care of patients that are very close to dying if not managed appropriately. They may be on a breathing machine. They may be having a machine that's pumping their heart for them. They may be on dialysis, cleaning their blood. And he's managing all of this and all the medications associated with it. And then we have Dr. Madison. So she provides care at two different settings. So the Hunt Ridge Family Clinic and Volunteers in Medicine of Southern Nevada. So as a part of that, she does a lot of public health work, specifically with HIV prevention, and she participates with or helps with gender affirming cases as well. And then she offers consultation on communicable diseases, and she also offers a lot of immunization clinics. So she works out in the community. So hopefully that piqued your interest a little bit about everything that pharmacy has to offer. And let me give you a little spoiler. That is just the tip of the iceberg. There's so many different types of pharmacy. There's types of pharmacy where you actually are in direct patient care. So maybe you love being a part of the future of treatments, or maybe you love medication therapies and deciding what is best for the hospital organization to use, but you don't want to be in patient care. There's jobs for you. There's also something called pharmacy informatics, where you're a part of almost the IT department, where you're helping to program safe technologies for administration of drugs, and you're a pharmacist. So much to learn about. Pharmacyforme.org is a great place to start to learn about other careers in pharmacy, hear other testimonials. They also have really great videos on applying to pharmacy school. How should I dress for my interview? What do I do to follow up? So they have some great tutorials as well that I highly recommend. So great website. I highly recommend checking it out. So, in general, now that we've kind of introduced how awesome pharmacy is, let's kind of talk about how do you get there. So, typically, pharmacy school is 4 years, but Roseman University College of Pharmacy is a 3-year accelerated program. So, that means that you have to get through high school and start entering into some college courses. College courses at the no matter where you attend them, if it's community college, if you're doing multiple colleges, if you're doing university, we're going to have prerequisite courses that you need to take. And we'll have those listed out here in a second. Once you complete your prerequisite courses, you're ready to come into the pharmacy program. You can get your bachelor's degree. Your bachelor's degree will make you feel a little bit more comfortable and strong about coming into this doctor of pharmacy degree. But essentially, from high school, you could graduate with your Doctor of Pharmacy degree in 5 years if you do it very quickly. Or you could be like me, take your time a little bit, and it could take a little bit longer. I actually did mine in 8 years because I did a undergraduate degree, and my pharmacy program was 4 years. So about Roseman, we have two campuses that have a College of Pharmacy. We have our Henderson, Nevada campus. So it is the only pharmacy school in the state of Nevada, located right there outside of Las Vegas. And then we have a campus in South Jordan, Utah, so a suburb of Salt Lake City. And we are one of two colleges of pharmacy located in the state of Utah. So what kind of courses do you need to take in order to be ready to join us? So it is required that you take General Chemistry 1 and 2 with lab, Organic Chemistry 1 and 2 with lab, Calculus, Microbiology, Anatomy and Physiology, and then English Composition and Speech. So those are your prerequisite courses that you must complete before entering into our program. You can apply with still having these courses pending. You don't have to have them all completed in order to apply, but by the time you would start with us, which our start time is in August, you would need to have all of these complete. So as far as admissions requirements, you have to have at least 60 semester credits. And then at the time of application, we request that you have 5 of the 8 math and science courses listed above completed. And the grades we look for in your math and science courses are a C or better. The grades we look for in your English and speech courses is B or better. And the reason we like to see the 5 of the 8 is we want to make sure that you really are set up for success in this rigorous Doctor of Pharmacy program. So what makes Roseman different? So Roseman University is founded on a mastery learning model. So that means that we essentially believe if you're going to go and practice in any area of healthcare, nursing, pharmacy, dentistry, whatever area it may be, you need to be excellent at doing so. If my dad's in the hospital for a heart attack, let's say, I want to make sure that the people taking care of him are the best. I want to make sure that I can trust them because I'm going to be stressed. He's going to be stressed, and I want to make sure he's getting the absolute best care. Well, our founders believed that to be true, and they believed anyone graduating from a healthcare university needs to be excellent. And so they set a passing rate of 90% for all of our programs. So to pass anything within our curriculum, you have to have 90 or higher. Is it hard? Yeah, it's tough. Is it challenging? Yes, it is. But you would be surprised how much you can achieve when the bar is set very high. And also, the other thing I want you to be aware of is our curriculum is set up in a way that is very different. It is set up in a way to support you in achieving this 90%. Because I'll tell you, if we just had a normal curriculum and we let you take the test once and everybody passed with the 90% on the first try every single time, that should clue us in that something's not right. It must be too easy. We're not testing appropriately. But we have a curriculum set up to support you in getting there, maybe not necessarily on the first try. So let me talk about some of the things that make it special. So we have our 6-point mastery learning model that has 6 components that help us. So one of them is our classroom is designed in a little bit of a different way to allow this engagement between the faculty member and the students. So you can see this is a picture pre-pandemic times. Now we have our students still in the classroom if they choose to be, but spaced out appropriately. But here you can see this is our classroom. It's shaped like a hexagon. Our students are no more than 5 rows away from the faculty. And that way the faculty can have a close relationship with the students when they're teaching. They can tell when they say something, the class is feeling very confused. They can tell if the like a particular student has a question. So it really allows for a little bit more engagement. And you can see above the faculty member, we have these screens spread out around so you can always see what the professor is presenting. And you also have your laptops and stuff like that in front of you if you, as you're taking notes and things like that. And then you'll notice around the outside of the classroom that there's these breakout rooms or these doors. And these doors go to breakout rooms where we can break off into groups so that we can work on cases together to help us solidify the material that we're learning. Another component is that we have a block curriculum. So in undergraduate studies, you'll take 4, 5, 6 classes at a time, and you'll be taking a little bit of calculus over here, a little bit of organic chemistry over there, a little bit of a PE course. I took tennis. So you're taking all these different things and you don't realize that, you're studying really hard for the organic chemistry test and not giving as much love to that paper that you have due in the other course. And we understand that that happens. It happened to me. It's called prioritization. You're like, I've got to deal with this to deal with this. And so everything gets about 80% of your time. It's not getting your full attention. Well, knowing that you have to pass with us at 90%, we want you to give full attention to your subjects. So we have a block curriculum where you focus on one subject at a time, 1 2-week period at a time. And so our testing periods are every 2 weeks, you're going to have a test. And during that period, all you're being tested on is the material within that 2 weeks. Take that test, pass it, and then boom, we're on to the next 2 weeks where you take one course at a time. So that's something that's really, really neat about our program and allows you to have that focus. Um, we'll talk a little bit about our actual testing days or our teaching days here in a second. Another thing that's really nice about our program is that we believe in different forms of teaching, which we'll talk about. One of the forms is that we think there's a huge value in hands-on education. All pharmacy schools, you're going to go out and have what we call experiential rotations, which is that hands-on experience. But some pharmacy schools, you don't do this until your 3rd or even your 4th year. But here with us, we believe in getting you in those rotation experiences within your first year. And so starting in October of your first year, you're going to be out in pharmacies once every 2 weeks. So you're going to learn something in class like, hey, the side effects of an ACE inhibitor like lisinopril are this, and I should counsel a patient on these. And you're like, I've learned it. And now I have a patient actually picking one up at the pharmacy. Wow, I get to like apply these things to real practice, and it helps you solidify that knowledge you're seeing in class. So during our program, you're going to have rotations all through your first year, your summer between your first and second year, and even your second year. Then your third year is all rotations, no more classes. You're going to spend the entire year rotating through the different pharmacies. So the other part that makes us very, very unique is our competency-based education system and our assessment learning. So we understand that the 90% is hard to achieve, but we want to help you understand the material to that level. It's not like, here's 90%, good luck, we hope you make it. We're here to help you say, what are you weak at? What are you struggling with? How can I help you? So a part of the competency-based education is that everything that you are taught is lined out so that the faculty members let you know what is important. Learning pharmacy is like learning a new language. You don't know what you don't understand. You don't know what is important when you're given a whole slide deck of material. You're like, do I study all of this? I'm going to study all of this. What about this tiny little bullet point? I'm not sure. I'm going to study it. Well, here at Roseman, we believe that we should lay out what is important in every single lecture for you. So our lectures and our exam questions are written based off of our learning objectives, which will be at the beginning of every single lecture. So this is us telling you, hey, flash, this is what's important. This is what you need to be an excellent pharmacist. And as a part of that, like for my slides, I always put on the bottom right corner, this slide corresponds to learning objective number 3 and number 4, so that you understand where the material is relating back to. And as a part of that, every single day, you're going to have quizzes in the morning and the afternoon, depending on the faculty member. So I let the students kind of decide if they want them in the morning or afternoon. But we do quizzes every day. They count for nothing. No grades associated with them. They're just there to assess how well you understand the material and to be like, ooh, I thought I knew that section, but I don't. I think I need a little bit more help there. So we're constantly working with you to help you identify those weaknesses. And then our teaching model in a classroom is a little bit different as well. So I mentioned that we're in a block system that works every 2 weeks. So every single day of that block, you're going to be in the classroom 8 to 3 o'clock, one class for 2 weeks, essentially, or one class period for 2 weeks. From 8 to 3, that sounds like a really long teaching time or a really long learning period. It is, but we break it up into sections that make it more manageable. And let me kind of paint this for you. So with me, you may come in 8 o'clock in the morning, and I'm going to teach you guys about acute renal failure for about an hour and a half. And then once we're done, I'll say, all right, guys, let's take a break, 15, 20 minutes. We take breaks. We have an hour-long lunch every single day. But I'll say, all right, let's take a break. When we come back together, let's get in our teams. I'm going to have an acute renal failure case that I want you guys to work on and solve. And as you're working in groups like they are here, I'm going to come around and say, all right, guys, what do you think? And you're like, oh, I think the answer is this. I was like, good. But what happens if this happens? And I'll throw a wrench in it and I'll run away real quick to another group. And so the thing that I love about our model is that you get to be taught by the faculty member, and then you get to study and practice with the faculty member. And so we're like, all right, guys, here's a little bit of practice. Then we come back together after all the groups are finished and we review. And I'm like, all right, I saw this common theme that it seems like the groups were struggling with. I can make some adjustments. Let's talk about this. And then once we're done reviewing, we'll move on to chronic kidney disease, and then we'll do another activity. So you can see that our classroom is constantly designed around teach a little bit, practice a lot of it. Teach a little bit, practice a lot of it. So that's really nice about our curriculum. So I mentioned that we have quizzes every day, but they don't count for anything. I also wanted to mention that we don't have any homework either. We believe that everything that you need to learn in the classroom is presented by your faculty. We don't want any mystery. I want it to be very clear that everything you need to learn will be taught by me. Also, there's no quizzes, so how does grading work? Well, as mentioned, every 2 weeks we will have an exam. Every 2 weeks on a Friday, everyone's going to come into the classroom. They're going to get on their electronic device, and we are, or essentially now we're doing virtual exams at this point, but we're all going to come together. We're going to take an exam individually. Individually, we're all going to take an exam. Once everyone is done taking that particular exam that covers that 2 weeks worth of material, we're going to come back together and we're going to get into teams like this group is here, and we're going to take the exact same test that we finished together. So this offers you the opportunity to learn from one another. I'll be like, hey, Lisa, I think number 2 is B. And Lisa's going to chime in. She's like, oh, actually, do you remember from class? Like, I actually think it's C. And I'll be like, oh, you're right. So it offers this opportunity to learn from your colleagues, learn together. Because at the end of the day, we want you to be excellent pharmacists. Excellent pharmacists. That is our ultimate goal. It also allows you the opportunity to learn how to work in a team given a little bit of a stressful environment, given a complex case. We want you to learn these skills because the future of healthcare, no matter what profession you choose, is collaborative, is interprofessional. It takes a team to take care of a person. So we want you to learn how to work together towards a common goal because that is your future. We also don't want you to go through all of this work and feel stressed and feel like it's not for anything. We incentivize this process. So if you and your team work on this test together and this exact same test that you all just finished taking individually, if you work on it and to get above a 95% on your team test, every single person on that team gets 5% added to their grade. Bonus, that's really nice. So that could help you to get above that 90% threshold that you need in order to pass the assessment. So after all the teams are done testing, we all come back into the classroom, and then the faculty puts the exam up on the screen and they share the questions and they go through the questions and answers question by question. So they open it up. All right, number 1, we thought it was C. I see everyone got it right. Great job. Let me tell you why it was C, just in case some people kind of guessed and got it right. I want to make sure that everyone understands this right answer. Then we'll go on to the next one and I'll say, all right, guys, number 4, we had a lot of people pick B, but B is not the right answer. Does somebody want to share with me why you picked B? And maybe Dr. Parker raise her hand. She'll be like, I picked B because of this. And I'll be like, all right, I see what you did there. Let me tell you why that's not right. So I love this about our curriculum as a teacher. It allows me to find where you're thinking about something wrong or where you learned something incorrectly and allows me to pivot and to change that. Then as a student, let's say that you picked B and you raise your hand, you're like, but I picked B because of this. And I'll say, oh, wait a minute. You know what? I didn't think about that when I wrote the test question, and you were not wrong. There's nothing wrong with your thinking. You know what? I'm going to have to take B as a correct answer as well. So it kind of opens up that dialogue to where we can help you remedy where you've learned things incorrectly. We can help you identify where your weaknesses are, build those up, and also lets us see where maybe we messed up, which happens fairly rarely, but there are times whenever I'm like, ah, shoot, I didn't think about that. And thank you for pointing that out. Then, after all of this review is done, the grades are released. The students that pass with the 90%, either by themselves or if their team helped to boost them a little bit, it doesn't matter. If you passed, you get the following Monday off. So every 2 weeks, you can have a Monday off. For those students that didn't pass, they come back in on Monday morning. They've had the weekend to study. They got a little printout that shows them what learning objectives they were weak at or the ones that they missed questions with. So they get more time to study over the weekend. They come in Monday morning, and then me, the faculty, or whoever the faculty member may be, we hold a 2-hour review session for the students that are coming back. And during that review session, we'll say, all right, guys, you saw the exam on Friday. You've had more time to study. What do we still not feel very good about? And somebody will raise their hand and they're like, Dr. Christensen Grant, I still have questions about varicose prophylaxis. When do I choose what what agent do I choose when? And I'm like, oh, great. Here's a case really quick. Let's work on it together. Show me and let me see what you're doing. And it allows this kind of conversation to open up as well. And then once all that review is done, you take another test, different questions, but same material. And then the very next day, you'll move on to the next 2 weeks worth of material. So you can see our curriculum is designed in a way that we, the faculty, are constantly coming in and saying, ooh, what are you not feeling good about? What can I help you with? Ooh, I see you're struggling with this. Let me give you a little bit of focused effort. And so that's one thing as a teacher I really love about working here at Roseman is that at the end of the day, my goal to make you a great, excellent pharmacist, this curriculum allows me to help give you that focus. I love it. I love it. I'm going to stop being a dork and move on. So I'm going to get close to wrapping up here. If you are interested in pharmacy, there's a number of different ways that you can reach out to us. We do have a personalized page for all of you guys that have attended today or that are attending on the web. We have this URL, or you can even take a picture of this QR code and it'll link you straight there to receive some more personalized information. We also have a Facebook page, an Instagram page. Those are great resources to see all the amazing things that our pharmacy students are doing out in the community, what they're doing amongst their classmates, competitions they're participating in nationally. We really share a lot of the fun stuff that's going on around our campus, so recommend there. And then you can always contact our admissions office here at copadmissions@roseman.edu or give us a call. We would love to chat with any of you. And then we'd like to thank you all for working with us today or attending with us today. And if there's any questions in the chat or if anyone would like to unmute themselves and ask a question, we're happy to answer any questions that you may have.